So today we will start about the bacterial infection. So there are various bacterial infections, but they all are very difficult to remember. So we will discuss only some important points and some important bacterial infections. So first of all, we will start with diphtheria. So what is diphtheria? Diphtheria, you all know. First of all, I'll just enumerate what I'm going to discuss in this video. So first of all is diphtheria, then actinomycosis, then sarcoidiasis, then blastomycosis, then cat scratch disease, which is also called oculoglandular syndrome of paranoids. Right. So we will discuss these disease uh, in this video. So first of all is diphtheria. So diphtheria is caused by Corynebacterium diphtheriae. Everybody knows, everybody is familiar to this disease. So it is caused by, we'll try to discuss only important points, as I've already told you. So I think this one is better pointer. So diphtheria is caused by Corynebacterium diphtheriae, right? And the main factor which we can see in the diphtheria are nasal resonance or nasal regurgitation. Right. So basically, the infection starts from pharynx up to soft palate. That's why you can see there is a pain in the soft palate. Painful soft palate. That means there is a tenderness in the soft palate, right? So it starts from basically pharynx up to soft palate. So there is a tenderness in the soft palate, and sometimes there is paralysis in the soft palate. So just remember, so there is a paralysis, there is a painful soft palate, and the tract which is involved is pharynx to soft palate, right? So it involves tonsillitis also. Right. So the main diagnostic tests are Schick test and Elk test. So just remember this, right? Very, very important to remember. And the membrane which is covering the soft palate is called diphtheric membrane. So the next one is actinomycosis. Actinomycosis. Now, what is, sorry, actinomycosis. So what is actinomycosis? Actinomycosis is also called ray fungus. So now it is a bacterial action, bacterial infection, but we call it as ray fungus. Why? Because it has the features. It has the features like the ray fungus. If we are going to look into it, then it is yellow colored. Yellow colored, right? Bright yellow colored feature, which is like fungus. It looks like a fungus, but it is basically a bacterial infection, right? So the main important feature of ray fungus actinomycosis are sulfur granules. Now what will happen? There is a formation of cervicofacial lesions. Cervicofacial lesions. Now in cervicofacial lesions, the lesions are having the granules, which form basically the granules which are having abscess, and in that the main content is sulfur. So just remember this: sulfur granules are the important feature, right? Then come to your third one is sarcoidosis. Now, what is sarcoidosis? Don't get confused in the actinomycosis and sarcoidosis. Sarcoidosis, basically, sarcoidosis is a multi-system granulomatous disease. Multi-system granulomatous disease, which means there are basically granule formation, right, which has giant cells, giant granulomatous cells surrounded by epithelial lining, right? Surrounded by epithelial lining. And the test for it is KS back test. That means Kevin Schitzbach test. It is a different name, so it is very easy to remember. Sarcoidosis with Kevin Schitzbach test, right? Then come to your one important thing to remember here is we have to take sample for the test, KSB test, from spleen and lymph nodes, right? Then come to your blastomycosis. Now, what is blastomycosis? Blastomycosis is almost the same thing. It has, instead of granulomatous granules formation, there are pus molecules, right? Again, the same thing is there. Giant cells surrounded by epithelial lining. There are pus molecules, right? Now come to fifth disease, which is called cat scratch disease. Cat scratch disease basically is caused by, as the name suggests, it is caused by cat scratch. So it occurs in the, it is also called oculoglandular syndrome of paranoids. So it is caused by Bartonella hensela. Okay. So what happened in this? It is a lymph node infection. It is basically lymph node infection, in which case lymph node infection. In this case, first there is formation of papules, which form pustule, further which form vesicles. Right. So there is basically lymphatic spread. So due to lymphatic spread, it is called as lymph node infection. Right. So in this cat scratch disease, there is discontinuation of skin. So there are formation of papules first, then pustules, then vesicles. Right. So that's what happens in cat scratch disease. So let us revise this. First of all is diphtheria, which is caused by Corynebacterium diphtheriae. There is the main feature is nasal resonance, nasal regurgitation. It starts from pharynx to soft palate, and on the soft palate there is and this tract has there is a formation of membrane which is called diphtheritic membrane, which is painful in nature, which becomes painful, and along with that there is a tonsillitis also, and further there is a formation of, there is a paralysis of soft palate also. So most important is the diagnostic test, which is Schick test and ELK test. Right. Then come to actinomycosis, which is also called ray fungus. It is actually a bacterial infection, but it is called ray fungus because it has features like a bright yellow color, which is a feature of basically the fungus, and it forms cervicofacial lesions, which contains abscess. These granules contains abscess, and the main feature is these are sulfur granules. These are sulfur granules. Then come to sarcoidiasis, which is multi-system granulomatous disease. In this, there is a giant cell surrounded by epithelial lining. The main test for it is Kevem Shitback test. You will get direct question on this test, and the samples we have to take from spleen or lymph node. Again, there is a blastomycosis, which is the same one. The difference is there are pus molecules rather than granules, sulfur granules. Right. Then come to a cat scratch disease, which is caused by scratch of cat. There is oculoglandular, which is oculoglandular syndrome of paranoid. Basically, there is eye involvement and there is involvement of gland also. Right. So it is caused by Bartonella hensel, the lymph node infection, which involves, there is first of all there is discontinuation of skin, then there is formation of papules, pustules, vesicles, and due to spreads along the lymphatic lymph nodes, it is a lymphatic infection.